Hello, everybody. Thank you so much for being here today. As you just heard, my name is Ruthie Arbit. I am a psychotherapist specializing in maternal and pediatric mental health. And today's session is going to be on what it's like to be pregnant or postpartum during the pandemic and specific strategies that providers, communities, and families can use to help some of our most vulnerable moms. You already heard a little bit about me from the introduction, so I won't go into that too much. But as you can see, I've done some advanced training in anxiety, advanced training in perinatal mental health, and also advanced training in cognitive behavioral therapy, which is one of the evidence-based techniques to help moms and families that are struggling with a range of issues. From it can be effective for depression, anxiety, OCD, panic, trauma. Our schedule for today, our session is going to be divided into 4 parts. We're going to start with a background on perinatal mood and anxiety disorders. And then we're going to talk specifically about COVID-19 and the impacts of the pandemic on what are called PMADs. The next part, section 3, we're going to talk about strategies for providers and families to use to assist some of these families. And then we're going to do the last session is going to be Q&A. So down to our nuts and bolts. So PMADs, perinatal mood and anxiety disorders, refers to the mental health complications that happen during preconception, pregnancy, and postpartum. A couple of things I want to say about this. So first of all, PMADs as a term, there have been some in the community that feel like the term connotes, a mad mom, and that's the image that we're conjuring up. So there have been a lot of clinicians that feel like a better term might actually be PMD, perinatal mood disorders. But for now, we'll stick with the term PMADs because that's actually still the most common term. The other thing I was going to say is, even though here it says, a lot of times when we think about depression and postpartum depression, the image that we come up with is, a crying, sad, depressed mom postpartum. And the reality is that image is actually much, much more than that, much more complex. So we'll get into the specifics, but, these perinatal mood and anxiety disorders can begin when you start fertility treatments. They are not just depression, they're also anxiety, they're also OCD, they're also trauma. They affect moms and dads and partners. They affect adoptive parents. So this is much more nuanced than, just that initial image that we might have of a depressed mom postpartum. As you see in the bottom part of the slide, baby blues, that's what many of you might know. I went through a little bit of my professional credentials earlier, but I'm actually also a mom of 3 and a local DC resident and therapist. I'm a mom of 3, and my youngest was actually born right before the pandemic, but I've sort of had a very close window into what it's like being a parent of a baby in the pandemic. But anyway, the second part of this slide is on baby blues, which is what many of you might know, which is, when after a mom has a baby in the initial postpartum period, this is usually about 2 or 3 weeks postpartum. That's when moms are really weepy, right? So I remember when I had my first kid, when I was sitting down to dinner one night and there wasn't any salt at the table, and I just started crying and crying and crying, right? So with baby blues, very natural response to having a baby, a hormonal shift. We say, some people say 50 to 80%. My supervisor actually jokes that it's only 80% because the other 20% are lying, that actually, baby blues are pretty much ubiquitous. So we have baby blues on the one hand, and then PMADs on the other hand. Those are 2 very different things. So one of the things that we're going to talk about a little more is how to distinguish that. So what are PMADs? We have a couple of slides of this. So first one, PMADs are the affect parents of 400,000 infants per year. They say 20% of new moms. That estimate we're assuming is actually underreported. So we're assuming that the numbers are actually much higher. And we do have strong evidence that that number is much, much higher with moms with low SES. So 33 to 50% of moms with low SES experience that. At a later point in our presentation, we're going to talk about COVID and what evidence do we have right now of COVID and PMAD numbers. But for now, this is the pre-pandemic PMADs numbers. Staggeringly, 50% of cases go unrecognized and untreated. You're going to see another slide coming up where actually they place that figure at closer to 75%. So if you think about this in the context of mental health across the spectrum, the fact that 50 to 75% of these families are struggling with an undiagnosed and untreated significant mental health complication is really astounding. As I said earlier, affects moms and dads. It's the number one most underdiagnosed obstetrical complication. And sometimes there's suicidal behavior. In rare instances, there's something called infanticide. We're not going to delve into that too much now, but if anyone has any questions about that, there's a lot of literature out there to dive deeper into that. Sorry, one sec. So again, emotional complications. Oh, so actually I didn't say this on this previous slide. Emotional complications are the most common complication of pregnancy. They can happen prenatal, they can happen postnatal. Some of the reasons why these happen, some of it is due to hormonal changes, right? Your body and your neurochemistry in your brain shift in pregnancy. And then they also shift postpartum. And they shift also if you're breastfeeding or chest feeding. Lack of sleep. That's a huge, huge, huge piece of this puzzle. And we're going to talk about that further when we get into some solutions for how to assist moms. Total change in lifestyle. I remember someone told me at some point, what happens from infancy until a child is 3 is absolutely miraculous, right? An infant, when they're born and they're sort of purely responsive and they just have the Moro reflex in those initial couple of weeks. In those short span of 3 years, an infant goes from being just responsive to being talking, thinking, feeling. Some 3-year-olds are potty trained. Some 3-year-olds know how to write letters, right? The 0 to 3 time period is absolutely incredible how many changes the brain undergoes in that time period. But aside from the 0 to 3 time period, the biggest shift that we will go through in our lives is going from being not parents to being parents. All of a sudden, from being independent people that are able to make decisions for themselves to all of a sudden having dependents that are completely take over and sort of dictate what your schedule is for those beginning couple of years. Right? There's a lot of relationship changes that happen. They said, another statistic is that 2/3 of couples report dissatisfaction with their marriage or relationship in the year following the birth of a child, right? There's a lot of relationship strain that happens in the postpartum period. There's bodily changes, of course. And then there's, mental health history and genetic predisposition, of course, are also playing a big piece in why PMADs happen. Within PMAD, so when we use that umbrella term, here are some examples of the different types of things that we're talking about. So we're talking about major depressive disorder. That's sort of the hallmark, when we always thought about postpartum depression, a lot of what we're thinking about is that major depressive disorder, right? Someone who has anhedonia, meaning they're not enjoying life. They might be crying and tearful. They might not want to get out of bed in the morning. They might not want to continue with some of the relationships that they've had, right? So we've got our major depression. We've got our bipolar disorder. which is a little bit different. It's the major depression plus episodes of mania, which can be someone, not sleeping, not eating, visions and ideas of grandeur. Then we have our anxiety disorders, and this is sort of going to be the meat of what we're talking about today. Then we have generalized anxiety disorder, which is a little bit different than the heading of anxiety disorders. We have obsessive compulsive disorder, panic disorder, and post-traumatic stress disorder. One thing, today the scope of our session is really on anxiety, but I'm sure that there is going to be years and years and years of conversations about PTSD and traumatic births during the pandemic. I think for so many families, their birthing experience, right? What that's like in the hospital. If you test positive, and, for a while, hospitals were separating moms and babies immediately after if the mom tested positive. So, you test positive and your support system is not able to be with you. You're masked. Your nurse and obstetric team is all masked. You have fewer doctor's visits, no visitors, no partners, and being separated from the baby. I think we've sort of set ourselves up for a lot of trauma for birthing parents. We'll get into it. We'll get into it further in a little bit when we talk about COVID and PMADs, but these are absolutely unprecedented times for families. Families are under tremendous stress from even thinking about, do I resume my fertility treatments or do I continue with my fertility treatments, to thinking about, oh, I think I might be pregnant, but can I even go to the store to get a COVID test? And then taking that pregnancy test and testing positive and then saying, do I now have to go into a doctor's office because now I've actually tested positive? And then do I have to go to another doctor's office for these follow-up appointments or for my ultrasound, or once the baby's born for the checkup, right? I think every single milestone along the way, from pre-pregnancy until early childhood, is really different now in COVID times. It's really different and really significant. And we cannot underestimate the impacts that all of this is having on our moms, dads, partners right now. But we'll get into that more. All right. I did not want to reinvent the wheel, and the Maternal Mental Health Leadership Alliance created this fabulous resource. So I thought it was worth just putting it out there. It's probably hard to see on your screens, but all of the resources included here are cited at the bottom. But yeah, you can go and find this resource and use it yourself in your clinics or for your families. This highlights some of the things that we've already talked about, right? The 1 in 5 women will experience maternal mental health complications during pregnancy or the year following. 75% of the women with this will go untreated. As a side note, we're using the word women, but just so we know, there's also, this impacts moms and dads. This impacts gender non-binary people. This impacts transgender dads, right? So the term women is actually, we'll use that term for right now, but it's actually a lot more nuanced than just that. Other stuff here, it goes through depression or anxiety are 2 most common perinatal mood and anxiety disorders. And then at the bottom, it also talks about who are women at increased risk, right? So women living in poverty and women of color are more likely to experience maternal mental health conditions, and they are less likely to get help. I'm just going to say that again. Women of low SES and women of color are more likely to suffer from PMADs and less likely to get help, right? We're going to go through another slide on some of the reasons for why that might be, including lack of access to healthcare. I'm reading now from the bottom of this slide. Lack of access to healthcare, including culturally appropriate mental health care. This is a huge, huge problem in the maternal mental health world. Cultural and racial biases in the healthcare system. More barriers to care, such as lack of transportation or childcare, and fear or stigma around the implications of having a mental health condition. So this is another slide on specifically PMADs in the African American community. So the Icahn School of Medicine in Sinai found that 44% of African Americans reported depressive symptoms after delivery, compared to only 31% of white women. Again, we talk a little bit here. Some of the things that I added that weren't on that previous slide include racial trauma, right? I think right now, as we all know, there's multiple pandemics happening, right? And the racial pandemic is absolutely impacting families across the world, across the US, and definitely here in DC. Another study, 2011 study from Harvard Medical School and Harvard Pilgrim Healthcare, found that African Americans were less likely to receive care and had lower rates of follow-up and continuity of care, right? So the continuity of care means, you go to a therapist and you do a couple of sessions, great, but are you able to stay consistent and consistently work with that provider for the duration of the treatment course? Okay, prenatal and postpartum anxiety. So we're going to talk about this a little more because, interestingly, I think for almost all of these, major depressive disorder, OCD, trauma, panic, all of these things look different in pregnant and postpartum moms than they do in the general population. Depression in a postpartum mom might look just like rage. It might not look like someone who's staying home, not getting out of bed, and crying all day. So depression, and that's for that holds true for all of the mood and anxiety disorders that we've discussed, right? These, the onset of symptoms, the severity of symptoms, the symptom presentation, how you treat these symptoms, every aspect of perinatal care is different and specialized and specific for moms in the prenatal and postpartum period, which is one of the reasons why it's really hard to find specialized care. It's hard to find specialized therapists. It's hard to find specialized psychiatrists. So that just, those are huge barriers to care, lack of specialized training. Okay, so what happens in prenatal and postpartum anxiety? How does this worry and anxiety manifest in the body? So it's interesting. So irritability, difficulty relaxing, sitting still, breathing, difficulty sleeping, difficulty concentrating, restlessness, and frequent checking behaviors. That can also be related to the OCD. We'll get to that. Muscle tension, head, mouth, and shoulders. I started to say a second ago that it's really interesting, and I'm just going to continue that thought. It's really interesting because I will have patients come to me and they'll say, I'm feeling okay, but I'm really struggling to stay concentrated during my work meetings. I'm finding my mind just going everywhere, right? And that can be anxiety. It's not just, it might sound initially like ADHD, but actually that can be anxiety. So these are some anxious thoughts that moms might have. And these are what we call thinking traps. So these are sort of those unhelpful thinking styles that might make anxious moms are likely to experience. And one of the things that makes it really hard for them to manage that anxiety. So one of the things that we do in therapy, and one of the things that I specialize in as a cognitive behavioral therapist, is thinking through what are the specific cognitive thoughts that you're happening, what are the specific cognitive thoughts that you're having, and how can we challenge those, not prevent them? How can we challenge those so that those thoughts can be more helpful, right? So how can we challenge that to make an unhelpful thought a helpful thought? So different types of thinking traps listed here. All or nothing thinking, right? And that's, you took an exam and you got a 98 and you say to yourself, what happened to those other 2 points, right? If it wasn't perfect, then I failed, right? So that's all or nothing. fortune telling. That's sort of this thinking of this is what's going to happen in the future, right? So for a pregnant mom, fortune telling might be a mom who's only 3 months pregnant, who's saying, oh my gosh, I know I'm going to test positive for COVID and I'm not going to be able to hold my baby when my baby's born, right? So that fortune telling. Catastrophizing, that seems a little bit similar to fortune telling. That's when you look at any situation and you sort of think about the worst outcome. So it's not necessarily related to the future. It could be related to the present, but that's sort of saying right now, right? Me right now, Ruthie, in this given moment, my house is probably just going to come crashing down. Maybe there's a tornado in DC, right? The next one is personalizing, feeling like this relates to you. So your mother or a friend didn't respond to your text. Oh, that must mean that she doesn't like me, right? Or, your OB appointment was delayed by 5 minutes. That must be because people are not aware of me and people are not caring about my time. Another thinking trap, the final one on this list, is emotional reasoning. And that's when you say something like, I'm feeling like that person doesn't like me or doesn't care about me, right? So rather than using the cognitive part of your brain, you're using the emotional part of your brain and saying, well, I feel this way. So these are all, there are others. These are just a couple of the main thinking traps that anxious moms can fall into. This slide is on so this is not COVID yet, where we haven't talked about the COVID yet. If you guys remember back to the initial slide where we went over the schedule, we were just going to do PMADs in general. So these are the anxious thoughts. The previous slide was on anxious thoughts for the general population. This slide is anxious thoughts specific to the perinatal population. Will my baby ever sleep again? That's a huge one. Right? Really, really huge. I talk to moms all the time that just wonder, my baby was up 5 times last night. It's going to mean that when my baby is 6 years old, they're not going to sleep. And it means my kid's going to have insomnia in college and need to take Xanax every night to go to bed. Right? There's a lot of different thinking distortions wrapped up in sleep. The other one, very common. If I go to sleep now, the baby's going to wake up in 5 minutes, so I should just stay awake. What's the point in sleeping, right? And this can happen a lot with new moms where they're awake and not sleeping and, just really not sure, if I sleep now and then the baby cries, then what was the point of that? I didn't need a 5-minute nap. But then if I don't sleep, will I ever get sleep again? So there's a lot tied into sleep. We're going to get to that in a little bit. This one, if I don't watch the baby, something bad will happen to her. So I should stay awake and watch. This I share when my oldest was born, even though I had already been a therapist working in this field for a while, my baby was born the first night in the hospital. For some reason, my husband and I just decided, we looked at each other and we're like, okay, it's your shift. And then we took turns staying awake all night, watching our sleeping baby to make sure she was okay. Right. And I think it was by night 2, we had figured out that was not a healthy idea. But of course, there is a natural inclination after having 40 weeks of having, or of course, some people deliver earlier or later, right? But around having 9 months of your baby inside your tummy and well protected. And all of a sudden having your baby outside your tummy and wondering, is the baby cold? Is the baby hungry? Is the noise level okay? Is the baby wrapped warmly enough? Is the baby fed, right? Is the baby gassy? Is the baby's onesie uncomfortable, right? It makes perfect sense that after months of just walking around and keeping your baby safe inside of you, that all of a sudden having your baby outside of you would bring up and spark so many new anxious thoughts, right? I mean, to me, it seems perfectly reasonable. Okay, again, going down the list, is she breathing? Is she choking? Is she eating enough, right? Then there's the bigger questions. Will my life ever be the same? Will my relationship ever be the same? Will my body ever be the same? Will my partner and I ever get to, stay up late watching movies the way that we used to? Will our sex life be different, right? Last one is my baby getting enough milk? That's a huge one too. There is a lot of research on how breastfeeding versus formula feeding and chest feeding, how all of these different ways of feeding a baby can significantly impact mental health, right? So, there's some studies on how breastfeeding can be very protective with the extra release of oxytocin. But then there are other studies on how if there's a parent that really, really wants to breastfeed and is not able to, how that can also be a very big trigger for a PMAD. Okay, we're up to part 2, and I think we're right on time, which is great. Part 2 of this is thinking about COVID and mental health. So, just as a side note, or just to lay down the groundwork, I think these past couple of months since the pandemic began, a lot of the conversation was around health and how to keep people healthy and what are symptoms and how to prevent COVID. And I'm really happy to see that now the conversation is shifting to what we call the second wave of the pandemic, which is the mental health wave, right? So now it seems like the conversation is encompassing both the health and the mental health components to this. As we said earlier, every aspect of this, every single aspect of the pregnancy and the postpartum period is impacted by COVID. There's not, for the general public that's not pregnant or postpartum, there's many things that are different, right? And many things that are different and many things that are risk factors for mental health complications, which we'll discuss on this slide. But I think for pregnant and postpartum parents, it's happens to be one point where every single aspect of care and life is different because of the pandemic. We cannot underestimate how difficult and stressful and traumatic this is for our pregnant and postpartum moms, right? We really cannot, not pediatricians, not OBs, not providers, not schools. Everyone needs to be thinking about how can we support our moms right now, and dads and partners, right? Okay, so here's some of the reasons why. Right now we're having this mental health wave during COVID, right? There's financial insecurity, of course, housing insecurity, right? A lot of people moving around and shifting around. Food insecurity. I think there was, I got a recent New York Times update on the number of kids that they imagine are going to suffer from food insecurity this year as compared with previous years. And it's astounding. There's isolation, right? That's a huge, huge, huge part of the prenatal and postpartum period. And what is an added stressor is this isolation piece. And we'll talk about that more in a minute. Lifestyle changes, right? Maybe you're not going to the grocery store as often as you used to. Maybe you're not exercising at your gym. You're not hanging out with your friends. You're not going into the office. Maybe you are going into the office and you're wearing tons of PPE. Maybe you are going into the office and your PPE doesn't feel sufficient, right? There's a lot of lifestyle changes. From a mental health standpoint, there are tremendous barriers in access to care currently. There's not, at least in the DC area, there are not that many providers that take insurance. The ones that take insurance are full. There are a lot of licensing restrictions. So even if you find the perfect provider for you, if that provider is not licensed in DC or not licensed where you are, that provider might not be able to render services. Every state has their own licensing laws. There's a lot of health anxiety. I see a lot of moms with health anxiety and OCD, specifically related to COVID. And there have been huge spikes in OCD and health and illness anxiety. There's loss, right? So there's absolutely the loss of family members, right? We know the numbers of people that we've lost to COVID is huge in this country and across the world. There's a lot of loss. And then there's also grief. There's grief related to, this wasn't the wedding I was supposed to have. or this wasn't the baby shower I was supposed to have, or this wasn't my retirement party that I was excited for, or this wasn't my retirement trip that I've been planning for 5 years, right? There's a lot of grief related to missed opportunities that due to COVID, people will be unable to experience. So COVID and PMADs. One study out of the University of Alberta, I noticed one study at the University of Alberta found that, and there are not many studies out currently, of course, because COVID is new and it's hard to look at perinatal women. There are a lot of different things that are there to protect perinatal women and children from being part of studies, which means that there is less research out there. But the study that we have right now that came out in June out of University of Alberta found that the pre-COVID anxiety rates were around 29%, and the COVID anxiety rates are more than double that at 72%. The pre-COVID depression rate was 15%, and this should say COVID depression rate. I apologize for that. The COVID depression rate is currently at 41%. Just to summarize what this slide means from that one, there's not many, but there are a few large scale studies out right now on COVID and perinatal mental health. But what this slide is telling us is that the anxiety rates are more than double and the depression rates are almost triple. That is huge. That is huge and incredibly significant. And one thing I had mentioned earlier, which maybe I'll just say a brief word about further, these rates we are expecting that this is underreporting, right? We are assuming that when people are going to their OBs or their pediatricians, wherever these research studies are taking place, that people, due to stigma or denial, or maybe someone else is in the room and they're uncomfortable for a variety of factors, we are assuming that these numbers are underreported, and actually the clinical rates are much higher than that. Okay, next slide. Again, ACOG, right? The American College of Obstetrics and Gynecology published another study in August 2020 saying, in summary, among pregnant women, more than half of the people that took this survey said that the psychological impact of COVID was severe, and 2/3 reported higher than normal anxiety levels. Again, severe, right? People reporting that their symptoms are severe and higher than normal anxiety levels. Here are some of the ways. So we've looked at this slide now. This slide is, what are anxious moms thinking? We've looked at this slide in the general population. We've looked at this slide in the perinatal population. And now this one is all around COVID and perinatal anxiety, right? So here are the things here are some of the thoughts that moms might be experiencing. If I leave my house, will I get COVID and make my baby sick? If my baby's sick, can I go to the pediatrician or will I get COVID? Can I go to my OB or will I get COVID, right? Can I go to my ultrasound or will I get COVID? If I get COVID, will my partner or family be able to join me in the delivery room? We lost our jobs. How will we provide for our baby? We're not in our usual home. How will we keep our baby safe? If I get COVID, will I have to deliver in a mask, right? And for some moms, sometimes you go to the hospital and it's 3 days before your baby's able to be delivered. And 3 days of delivering in a mask sounds really unpleasant. If I don't get to have a baby shower due to COVID, will my baby have everything they need? If I don't see people due to COVID, will my baby know their grandparents or aunts and uncles or friends or cousins? If I don't see people due to COVID, will my baby not have social skills? I hear this one a lot, right? As a mom of an infant, I know it's It's really hard not to have access. There's no libraries, there's no play dates, there's no play groups, there's no music classes, there's no playgrounds, right? There's a lot of places where normal infant and toddler social opportunities are not allowed to take place right now. If I don't see people due to COVID, will my friends ever get to know my baby, right? There's a feeling of this social piece. There's, bringing a baby into the world. Sometimes there's a baby shower. Sometimes once the baby's born, there are visitors. There's this whole aspect of it where there's this whole social aspect of it, right? Where people get to see your baby and hold your baby and say, oh, look at that baby's toes and look how cute. And oh, the baby has your eyes, right? Those micro moments, they seem small, but actually those moments are really, really important. They're really important for families to feel like they're seen and they're heard and that this milestone is being celebrated in a way. Who will care for my baby if I get COVID, right? And then there's, of course, like my baby's sneezing. What if it's COVID? My baby's sneezing. My baby's spitting up. My baby's rubbing their ears. What if it's COVID? My baby's poops don't look normal. What if it's COVID, right? There's a whole slew of anxieties related to the health of the baby and wondering, is the baby's health right now compromised because of COVID, right? So this is just a beginning. There's a lot more, as I'm saying this, I'm thinking about for families that have had other children with medical illness, wondering, what if this baby gets sick too, right? Or for parents or adults that have a family member with mental health or health issues, right? Wondering, well, what if this baby gets sick, right? So this is just a preliminary list. And of course, there's many, many more. So now we're to our third part, right? What do anxious mom needs? What do anxious moms need? How can we support them? So there's a whole range, right? So the first part is validation, letting these moms know this is so, so, so hard. This was never how it was supposed to be, right? This idea that it takes a village, right? It used to be, we thought raising a baby, it takes a village, right? You need to have your grandparents nearby and aunts and uncles and cousins and teachers and doctors and, neighbors, right? We are asking new families to do this all alone with no village, no visitors, no one bringing meals, no one helping do night shifts, no one coming in and, delivering baby goods or diapers or any of that stuff, right? There's this other idea you see on the slide, the fourth trimester. So the idea that you have 3 trimesters of pregnancy, and then the fourth trimester is this 12-week period where you're just acclimating to what does it mean now that I have this baby at home, right? How do I manage this? How do I manage the diapers? How do I manage my own needs? I haven't showered in 4 days, right? How do I balance what it means to have a baby home? So that's what we call the fourth trimester. In the past couple of years, there's a new term out there too, the fifth trimester, which we call like the back to work trimester, right? So if you go back to work, the fifth trimester is all about figuring out, how will I feed my baby when I'm gone? How will I make it home from work to pick up my baby? How will I manage my work demands at night if my baby's up all night, right? So this another transitional period, another trimester that takes time to figure out and get your feet underwater, get your feet on ground out of the water. Social supports, right? Anxious moms. Yes, people are in tremendous isolation right now, but we need to try to be creative and think of how we can support these families. So online groups, there's a number of different online groups. There's a number of them that are paying. There's a number of them that are free. There are a number of them like Postpartum Support International run specialized groups, right? So they run groups specifically for African-American moms. They run groups specifically for moms that have had a baby in the NICU. They run groups for moms that have had a prior pregnancy loss, right? So there are a lot of specialized groups. What you can do if you are a family member or you are a pediatrician or you are an OB, instead of telling a mom, go find an online group, find that group for her, right? And say, hey, do you have anything on your calendar Tuesday nights at 7:30? Postpartum Support International has this group. Here's the link, right? Whatever we can do to make that to eliminate those barriers, whatever we can do to bring the resources to the moms will be tremendously helpful, right? Phone calls, texting, FaceTime, do all those things, way more than you're comfortable with, right? Sleep. This is a huge one. We've talked about this in our slides around how is this time period just anxiety provoking. This is a huge one, right? So even if you get 15 hours of sleep, if all of that sleep is just in the form of cat naps, right? So 1 hour here, 2 hours there, 2.5 hours here, 45 minutes here, that is not restorative sleep. We know you need to have consecutive hours of sleep, ideally 4 or 5 hours, in order to actually feel like you've received restorative sleep. Usually for people, the most important time that you can get that sleep is the first chunk in the nighttime, right? So if you're a partner and you have a mom at home who's feeling really anxious or tired, you can say to her, you know what, I'm going to do the first shift. I'll take the baby from 8 until 1. You go sleep. And then from 1 onwards, I'll sleep and that person takes over. But making sure that moms get that 4 or 5 hours, and ideally, we want their big chunk to be at the earliest part of the night if possible. Right? So partners or parents can come help. There's postpartum doulas. I know that there's some, especially in DC, we have a couple of amazing postpartum doula agencies. We have a couple of amazing doula agencies that also support moms during labor and delivery. These postpartum doula agencies, some of them are taking extreme precautions, so they're able to help despite COVID, which can be hugely beneficial for moms. Healthy lifestyle. That's a really important one, right? Nutrition, exercise, drinking water. I had a mom recently that said she was hospitalized for dehydration because caring for her infant, she forgot to drink water for I don't know how long, but long enough that she required hospitalization for that, right? So if you're a partner or you're a family member, some of the things you can do is say, let's keep a bag of almonds in every room in the house. So anytime you're hungry, you can grab some almonds. Or if you're leaving the house, you say, before I leave the house, can I make you a peanut butter sandwich, right? Making sure that whatever we can do to take the job out of it, however we can simplify matters, that will be hugely helpful, right? Even something like, I'm going to put the diaper on the changing table so that it's ready for you next time you need it. Right? Like anything that we can do to make life easier. I'm going to make you a smoothie and I'm just going to leave it by your bedside, right? It's really, really hard for moms to wake up, to think, let alone to do things like prioritize exercise or nutrition, right? When I say exercise here, I'm not implying, run a marathon, not even running. Maybe it's just a 15-minute walk. Exercise, the truth is that from a mental health standpoint, rigorous exercise, and I think it's supposed to be at least 30 minutes multiple times a week, rigorous exercise has been shown to be incredibly effective for depression and anxiety. So moderate exercise is definitely excellent from a mental health standpoint, but sometimes possibly unrealistic for a new mom, right? So maybe it's do 15 minutes of stretching your back or a YouTube yoga video while you can. This is a topic for another conversation, but I've even heard there's even like breastfeeding yoga. So you can do yoga in a different position and breastfeed your baby simultaneously. Talk about multitasking, right? Cognitive strategies, right? So as a therapist, there are a lot of different cognitive strategies that we can use to help moms with these anxious thoughts, but also saying, what's within my control, what's not within my control, right? You planning ahead 3 months down the line, what if I catch COVID? in 3 months from now, not within your control, right? You saying my delivery date is in 2 weeks from now, should I eat at that indoor restaurant? Definitely within your control, right? So some things are within your control that can help. Some things are not within your control. Of course, if you have any concerns, talk to an OB, a pediatrician, or another therapist. This is another amazing slide another amazing resource that I love. This is done through the DC Collaborative for Mental Health in Pediatric Primary Care. It's available on the DC Health Check website. And, on the front page, it talks about some changes that you can make at home. But the reason why I really love it is the back page is an actual behavior activation plan, right? So one of the things that we know from a mental health standpoint is we're not going to wait until you're in crisis mode to start planning what do you need to get help, right? Once you're deep down in that hole, it's much harder to dig your way up than it is to put preventative practices into place to prevent you from falling down that hole to begin with. So my maternal well-being plan, I use this often, almost all the time. It's a really, really helpful tool because it tells you things like, who do I go to for help when I need it, right? What are some ways that I can connect with other people? What are my own early signs that I'm feeling bad or anxious, right? This says, put your therapist number on here, right? So that in that moment, and we hope you never have to, right? We hope no one ever has to use any of these crisis resources. But in that moment, if you are really struggling, you don't have to think. All you have to do is pick up your piece of paper and see what's my plan. I already wrote this down. What are my strategies, right? Here's the number. This also lists the number for WIC, right? If you're a family experiencing food insecurity, it lists 911, suicide prevention hotline, right? Really helpful resources here. This next worksheet, also not designed by me, you can see on the bottom where it came from. This is called the COVID Coper in Pregnancy, right? And this tells moms to do things like observe your body, right? Calm, thinking of breathing techniques. There is a lot of research on the impacts of mindfulness and meditation and mental health. Absolutely, unequivocally, right? Those can be really helpful. I will say they can also be really hard, right? It's not easy for someone with anxiety or a postpartum mom who has 9 million things to do. It's not easy for that mom to say, okay, I'm going to take 5 minutes and just sit here and focus on my breathing and focus on, my body and how is my body feeling, right? Definitely helpful, but also really hard. But let's look at some of the other things we have here. We have prepare, remember, right? Soon you'll meet your baby and become a family, right? So these are all strategies during pregnancy. Pause, right? Take a stock of the miracle that's your body and your baby. One thing we didn't talk about too much, but just a side note is, the impacts on your body, right? For a lot of people, you spend many, many years getting comfortable with what does your body look like, right? And maybe sometimes you're less comfortable with it. Sometimes you're more comfortable with it, but you have many years of adapting and figuring out what is my body and who am I as a person, really? And then all of a sudden, in pregnancy, in a really, really short period of time, in less than 1 year, your body morphs completely. Not only do you have a watermelon on your belly, your shoe sizes change, your hands change, your eyes change, your gums change, your hips change, your ribs can change, right? Almost every physical aspect of your body changes. And it's the same thing, not just your body. It's the same thing with your mind, right? If you have a baby at 35, you had 34 years to figure out, who am I as a person? What are the things that I like to do? How do I spend my time? How do I motivate myself to get up and out of bed in the morning? And then all of a sudden, you go into the hospital, you deliver a baby, and you've got like however long you're in the hospital until you get home, right? So 48 hours to figure out, who am I as a parent, right? And of course, when the fetus is in you, you're also a parent. And of course, that whole time in the hospital, you're a parent as well. But meaning you had 35 years to figure out who are you as a person, and then just a matter of months or just a matter of days to figure out, who am I as a parent. That is an incredibly vulnerable new identity to wear. I think that's I think that that's one of the reasons why it's really hard for postpartum families to make relationships, social relationships, because of that added level of vulnerability. Okay, similar to the one that we just had, but of course this is for postpartum. And then we have our resources section, right? So here I'm happy to send this to anybody if anybody has any questions, but these are some books that I found to be particularly helpful. Listed here, Penny Simkin and Karen Kleiman are sort of two of the leaders in perinatal health and mental health. These are all some apps. So the first couple of apps are therapy apps that I find really helpful. Then there's some breathing apps, and then there's some just general perinatal educational apps. And then lastly, a couple of different websites that I love. So DC Perinatal Mental Health in DC, we are amazingly fortunate. There's a consortium, a group of us in the DMV area that all specialize in perinatal mental health. And we work together and we attend advanced trainings. Postpartum Support International does amazing work. Postpartumprogress.com, you can still access some resources on that site. Postpartum Stress Center and Marseille Society. And that is it for my presentation. And now I think we're open for Q&A. Just waiting for the host there to help us with that Q&A. Maybe I'll stop my screen share. Okay, let me see. Sorry, there's a message here in the chat. Okay, great. How can we identify if it's an anxiety, irritability disorder, or if it's just mood changes due to the fluctuation of the hormones, which is normal in pregnant women? Great question. I think that the answer to that is, if you have any questions, if it's just not seeming right, then you should consult a professional, right? Pediatricians, OBs should be able to assist you with that. The slides that one of the initial slides that we went over went through a little bit of those different symptoms, but we're not expecting the audience to be able to, we're not expecting, I don't know if that person was a mental health professional or not, but we're sort of not expecting partners to necessarily be able to differentiate if this is a normal postpartum response or this is actually a mood disorder. So if you have any questions, please see our provider. Are there any insights on the mental health and COVID impact for preemie parents in the NICU? Yes. We don't have a lot of research out of it. What we know about preemie parents so far, those numbers that we looked at about trauma and anxiety and depression are incredibly magnified for preemie parents. I think I assume as a mental health therapist that 100% of families that are in the NICU are experiencing some form of trauma or anxiety. Absolutely, during the times of COVID, that is magnified. Absolutely. I don't know that we have any research out on that right now, of course, because COVID is new and research takes time, but undoubtedly. How do you help get people past the stigma of therapy so they can get the help they need? Great question. Really, really difficult. I think some of the things that we do, one of the things that we've talked about in the DC area is integrating the mental health conversation in all aspects of care, of medical care, right? So when you come in for your 6-year-old checkup and the doctor says, do you have any medical issues? And you say, yeah, my kid has a stomach ache. You're also going to say, and my kid gets anxious about XYZ, right? And the doctor's So we want the parents to be the ones to be forthcoming about that, but we also want the doctors to be asking about that, right? So the doctors to be saying, how is the child sleeping at night? How are they feeling? What are stressful situations for that child, right? So we really want this mental health conversation to be happening among families and among providers at every level. So when you come in for your OB appointment and your doctor says, how are you feeling? Are your feet swollen? And how are your moods? And how are you sleeping? And have you noticed yourself to be a little bit more irritable, right? We want everyone to be asking those questions. Okay. What can we do to actively support the mental health of our babies as they grow up? Great question. I think there's a complicated, I don't know if that question is for COVID or just in general. To answer that previous question that we talked about, reducing the stigma, I think it's the same thing with mental health with kids, right? Talking about things. I'm a firm believer that you talk about everything, right? Like your kid is scared about his fish dying, talk about it. Your kid, you have there's COVID out there. I know so many parents, their natural inclination is there's a pandemic out there. We're going to shield our kids from this. So we're not going to talk about it. And that makes sense. That protective urge makes sense, but it's not helpful for kids. It's not. There's a lot of research on avoidance and how avoidance actually increases anxiety, right? Kids know this isn't normal. So if we don't talk to them about it, they're coming up with all sorts of ideas in their head. So we need to be open with them and honest with them. Of course, we need to be developmentally appropriate, right? You're not going to tell a 3-year-old, oh, this is COVID and this is what an ICU is and this is how you intubate a person, right? Absolutely not. But you could say things like, I watched a video called all about the yucky bug, and the yucky bug is here and we have to protect ourselves from it. So we wear masks and we stay inside and we wash our hands a lot, right? So developmentally appropriate, but have those conversations. Next question. Chest feeding is a new term for me. Am I understanding it correctly as feeding the baby from a bottle chest to chest? No. Good question. Chest feeding is what had normally been thought of as breastfeeding, where you're putting your breast and feeding the baby on a breast. Chest feeding is for transgender or gender non-binary folk who don't want to use the term breast. They would rather use the term chest, right? So it could be a dad, so maybe a trans person, a transgender identified person that is breastfeeding their baby and prefers the term chest feeding to breastfeeding. Where can I find my maternal well-being plan you shared? So that's available on dchealthcheck.net. So dchealthcheck.net has a number of amazing resources. And you can actually even just Google that and Google, my maternal well-being plan. There might be a way as well. I think I can ask the AV squad here to send out some of those resources or send something out after. Or there might be a way for you to contact me too, if that wasn't clear. These are really great questions, guys. Any others? Okay, wonderful. Well, wait and see if any others come in. I'm happy to answer them. It was really a pleasure. This is a little bit bizarre because I only see myself in the screen. I don't see any little faces in the Zoom box. But it was really a pleasure to talk to you guys about this further. Thank you for being engaged and caring and for working hard to support our families. They need it now more than ever. So thank you for doing your part. Have a great day.